The MG collection is presented in 5cc sterile vials. These are double-walled and also double security sealed. Each of the vials features sterile solution, but also a silicone nozzle, which allows you to easily and effortlessly apply directly onto the patient's skin, but to also use a 5cc luer lock or 5cc syringe to now create the ultimate of customization. So you can either draw your product out and then apply to the skin topically. Alternatively, you can then mix and match multiple MG collection products to further customize your procedure. The solution is sterile, but even when you take the top lid off, it then becomes aseptic with 6 months lifespan. You will not need to refrigerate it, and it enables a safe and predictable mesoglide. Mesoglide refers to mesotherapy, but also a lubricating procedural glide. You cannot DP4 on a dry skin. You need a facilitating agent that will maximize lubrication and movement through the skin to promote your comfortable gliding technique. But at the same time, we now maximize the mesotherapy potential for your chemical regenerative medicine based on indication, based on a combination of indications for you to easily customize. You have versatility with each of the products to treat and target for face, body, and scalp indications. You can also mix and match any combination of MG collection products. So if you see hyperpigmentation plus deep rhytids, you can blend. If you see acne plus post-acne scars, you can also blend. Applied topically onto the skin, your MG collection will facilitate with a minimum of 10 milligrams per milliliter to a maximum of 35 milligrams per milliliter of triple molecular weighted non-cross-linked hyaluronic acid to now facilitate a smooth, comfortable move on the skin, but to also serve as a potent delivery system, an encapsulation system, and a time-release system physically within the skin. The technology is non-cross-linked, so there is no risk of granulomas and no risk of vascular occlusion. The benefits now open up a new opportunity to deliver active agents into the skin without injections, from more superior administration without injections and without the risks and the downtime of injections, particularly hematomas or bruising around the periorbital area, and particularly also redness and swelling following the procedure. Now you can treat both mechanical and chemical rejuvenation in as little as 3 to 4 minutes. This opens up new opportunity for needle-phobic patients. This opens up new opportunity for a more affordable and profitable procedure, but new opportunity for superior administration, distribution, and infusion of a procedural active within the skin. So we now open up new horizons, new potential for not just your MG collection, but for drug delivery, for exosome technology, and even the facilitation of PRP. Every corrective in clinic, every MG collection product, and every home care DP Dermaceuticals product is featured, highlighted, and based on the Hyalofuse hyaluronic acid patent. Under normal circumstances, as we have established with the skin's barrier function, a water in oil emulsion, ingredients and products don't typically break through the skin's acid mantle. Developed by the Matrix Biology Institute, the world's largest research governing body for medical uses of hyaluronic acid, above and beyond just aesthetics, consider synovial joint fluid, what we have is a triple molecular weighted hyaluronic acid that has been manipulated to open up new opportunity. The largest molecular weight is 1,800 kilodaltons, the medium 1,600, and the smallest is just 10 kilodaltons. Independent clinicals produced at Monash University in Melbourne, Australia, have tested this technology and have shown via a hematoxylin counterstain test where the hyaluronic acid molecule is dyed darker color, and then the product is applied topically to an intact and alive human forearm, no injection, no needling, no exfoliation or other facilitation, and then after 20 minutes, a punch biopsy determines if and also how deep the hyaluronic acid has penetrated into the skin. After 20 minutes of just topical application, you see the small and medium molecular weights in basal epidermis and some placement in epidermal junction. Again, after 20 minutes of topical application, we see the smallest molecular weight at 10 kilodaltons penetrate down into reticulodermis. So through this manipulation, we open up new opportunity above and beyond traditional topical products to now deliver through the skin's barrier function, but as part of your in-clinic MG collection, an encapsulating system that uniquely delivers and protects other procedural actives and agents, allowing for a time-release system within the skin. We create the versatility and intensity between 10 milligrams per milliliter and an unprecedented 35 milligrams per milliliter in our MG collection HA35 and HA35+. It is non-crossed technology with no risk of granulomas and no risk of vascular occlusion. Calphosome technology also had its origins particularly within the filler market too. However, calphosome is the trade name for what is more commonly known as hydroxyapatite or calcium phosphate. What we have is a micro delivery sponge system that is non-polymer but also non-liposomal. The work of calcium phosphate delivers particularly success for oil-soluble ingredients such as retinoids, retinaldehyde, to break through the stratum corneum and to now promote delivery system within the skin. This aids a time-release system. This aids encapsulation to now promote longevity but high performance of every ingredient into the skin. The role of calcium phosphate works within your skin's own natural barrier function and within its own acid mantle to now promote an easy tolerance and an easy penetration. In turn, this stimulates the production of lamellar granules, which are responsible for the release of both ceramides and free fatty acids, But particularly through the pioneering work of Van Loghem in 2015, we understand that calcium phosphate or hydroxyapatite can also directly stimulate fibroblasts themselves. We still consider both Hyalofuse and also our calcium phosphate calphosome technology as regenerative procedures. So as such, no risk of granulomas, no risk of vascular occlusion, and they simply degrades into a calcium or a phosphate ion. This appeases the naturalist modern patient, but also the high-tech modern patient as well, for the ultimate of delivery system, the ultimate of purity, concentration, but procedural versatility. Telomere technology is a Nobel Prize winning technology. A telomere is a repetitive nucleotide that is found on the end of chromosomal strands. To make this process a little more simple, I want you to imagine it's a lot like a piece of string. When we are younger, the piece of string is about 11 kilobases long. And throughout life, it undergoes replication about 2,500 times. So, by aged patients, we see the reduction of 11 kilobases down to about 4 kilobases. This now contributes to senescence of cells. This now affects DNA quality and RNA quality, but also the performance of the skin. This also contributes to the overall aging of the skin. The telomere technology is an ingredient called geranyl lysopropanol, and it is found exclusively only in the MG collection HA35+. And this promotes a new approach for regenerative medicine and a new approach to deliver the synergistic effect of both mechanical stimulation, DP4, and chemical stimulation with your MG collection. Treatment of all forms of hyperpigmentation may be successfully used with a combination of DP4 and the MG collection BL. However, as an update for recalcitrant chronic hyperpigmented conditions, we need to understand that there are multiple intervention points. As such, we must treat above and beyond with just tyrosinase inhibitors topically. We understand that whilst laser and cryotherapy treats and targets the pigment we see right now, it has no reversal or curative effect to prevent from the future. We also understand the melanogenesis process is complex, and so simply intervening just one or two aspects of the melanin synthetic pathway will provide a minimal long-term effect. As part of understanding the MG collection BL, its combination therapy with DP4 opens up a new horizon that treats and targets all aspects of melanin synthetic pathways. This includes a synergistic approach of DP4, melanocyte growth factor, keratinocyte growth factor, epidermal growth factor, the role and value of your Mg collection BL, but also the instrumental role of home care with DP dermaceuticals. To understand the melanin synthetic pathways with greater capability and how to infuse them, I refer to a system from 2007 that is called the Rendon and Gaviria system. Rendon and Gaviria are dermatologists based in Florida, and Jorge Gaviria is also a cosmetic chemist in background. They identified that a mere tyrosinase inhibitor no longer cuts it. They also identified that just topical application of a melanosome transfer inhibitor no longer cuts it. In fact, it never did. The issue is when you apply ingredients to the skin surface, they're not penetrating down here. So the challenges of traditional prescription products are working up here, treating and targeting the keratinocytes already affected, but are not working to reverse the imbalance of melanogenesis process. Rendon and Gaviria identified that there are 6 steps that you must intervene in order to provide a long-lasting effect. The first 3 are influencing before melanin synthesis. Number 1 is your tyrosinase inhibitor. This should be familiar for you. Tyrosinase is a copper-containing catalytic enzyme that then sends a message of inflammation and oxidation, darkening and bulking and oxidizing the tyrosin enzyme. The aim of intervening the melanogenesis process is not to smash down any structure. Its aim is to keep to the original blueprint. Your original blueprint, what should be your skin color, your genetic skin color, is called constitutive pigment. If you're not sure, perform at home the bum test. The skin you see here is what your skin should look like. So when we see changes of tonal pigment, this is referred to as faculative hyperpigmentation. Faculative hyperpigmentation is an altering to your skin's blueprint. For example, I want you to imagine that an architect or draftsperson has created a plan or blueprint for the building of your house. If your house is designed to be 1 story and 4 bedrooms, then we don't want to smash the house down. What we want to do is build and support that house according to the blueprint. So when we intervene the melanin synthetic pathways, what we are doing are removing the extensions, removing bedroom number 5, removing the 2nd story, removing anything that is not on the original blueprint. The second intervention point is called a peroxidase inhibitor. We are more than aware that oxidation creates rust and creates degradation. As such, there are 2 forms of oxidation. We have free radical attack, and we have another category that's called non-free radical attack. The other term for this is called a redox agent or reactive oxygen species. The first category to consider are peroxidase inhibitors. What creates the capability to be highly antioxidant? It's to do with your strength, your concentration of bioflavonoids, polyphenols, and tannins. And with this, and particularly botanical extracts, these now become a way to slow down the oxidation and the inflammatory messaging of tyrosin, but also L-DOPA and L-DOPA quinone phosphates. The third step before melanin synthesis that you must intervene is our second intervention for oxidation. So this is called a redox agent or a reactive oxygen species scavenger. So reactive oxygen species is commonly called ROS. So we must now bring these ingredients physically into the skin, not just topically. And so the combination of both your DP4 and your MG collection BL now begin to intervene directly in, on, near, and around the melanocyte, its failing relationship with the keratinocyte to activate and stimulate epidermal growth factor, keratinocyte growth factor, melanocyte growth factor, but to now intervene the melanin synthetic pathway before the melanin has been produced. How do we treat and target the melanin that is already being produced? Well, again, Rendon and Gaviria identify that there are 3 intervention points that must be taken care of. Otherwise, you will not create longer-term management. Step number 4 is to treat and target tyrosinase degradation. Your melanocyte, as we explored with examples this morning, is a lot like the pitcher in a baseball game. The pitcher holds the melanosome, the ball, and then is designed to signal and to throw that ball so it is caught by the catcher. We understand that all of our cells are coated by a phospholipidic barrier or layer. If this layer becomes interfered, if this layer becomes weakened and its integrity becomes compromised, it's a lot like the pitcher of a baseball game, instead of throwing the ball, leaking out the pigment. So with this process, the role of tyrosinase degradation is to re-support the phospholipidic barrier of the melanocyte, similarly to a bandage, to cover up areas of leakage and to re-strengthen to prevent leakage, but to intervene for melanin production after it's been produced. Step number 5 you should be familiar with, but this is called a melanosome transfer inhibitor. A melanosome transfer inhibitor works by slowing down the baseball game, works by stimulating the messaging. As such, pitcher with the baseball, the melanosome, and the catcher who's going to catch it. So now by instigating regulated communication, throwing the melanosome, which is then caught by the catcher or the keratinocyte, we now create a regulation. So instead of the ball just being thrown in any direction, instead of the keratinocyte struggling to catch, what we now create is a regulation and a slowing down that rebalances melanogenesis, but also correct pigment placement. The final area of intervention is cellular resurfacing. If I were to give you a pencil case of colored pencils, all colors, and if I were to ask you to draw me a melanocyte, most people would grab the brown pencil and draw a dendritic cell. The melanin at this point is relatively clear. It's not until the melanin has been transferred into the keratinocyte that we begin to see the darkening in the form of U or phe melanin. In this case, if we can turn the cells over quicker, accelerate keratinization, then we are able to refresh and rejuvenate quickly. So our approach here, to tie this in so it now makes sense, we want to use a combination of DP4 plus ingredients facilitated by the MG collection BL and patient home care to now intervene all of these aspects. The only other area of consideration is daily application and reapplication of an SPF. Your DP4 will stimulate epidermal, melanocyte, and keratinocyte growth factor. But the role of your MG collection BL features 10 milligrams per milliliter of triple molecular weighted high diffuse hyaluronic acid to glide effortlessly across the skin, but identify tyrosinase inhibitors, tranexamic acid, kojic acid dipalmitate, and licorice. Identify another intervention point as peroxidase inhibitors, licorice and bearberry. Identify also a redox agent, reactive oxygen species, vitamin C, and also identify through keratinocyte growth factor, we see resurfacing of the skin. So with home care products, we now intervene all aspects of the melanin synthetic pathway. You don't get this with a laser. You don't get this with a chemical peel. You don't get this with a prescription tyrosinase inhibitor. You get this as part of a synergistic approach with DP4, MG Collection BL, and DP Dermaceuticals. So what we now enable is a reduction of inflammatory and oxidative mediators which contribute to melanogenesis. What we now promote is a balance which serves as versatility for all forms of hyperpigmentation. Facultative uneven skin tone, ultraviolet aggressed lentigines, treatment of post-inflammatory hyperpigmentation, treatment also of ephylidase, and also epidermal, mixed, and dermal melasma, as well as other forms of dermal hyperpigmentation. All you need to determine is if your pigment is epidermal, orange, gold, pink, yellow in color, characterized by speckled pigment deposits. In the case of melasma, a solid interior, speckled exterior. Alternatively, if it's mixed or dermal, it'll be characterized by a blue, green, gray undertone, and the shape will appear as a solid border with a speckled interior. So our synergistic approach now creates pinpoint precision. Your visual endpoint for pigment is either no blood, red skin for epidermal, or the occasional pinpoint blood for your dermal hyperpigmented conditions. The concept of treating active acne, stage 1 comedonal, stage 2 papulopustular, and stage 3 nodular cystic, we have mapped up, explored, and drawn to understand that you can successfully use your DP4 for treatment of these conditions. The MG Collection CLR now delivers precise chemical regenerative benefits that works as a synergistic approach with your DP4. The acne cycle is a combination of thickened sebum production, a combination of retention hyperkeratosis, sealing off of the oxygen facilitating follicle, which now sees the movement of Cutibacterium acnes from the sebaceous gland into the follicle. The Cutibacterium acnes then recruits Staphylococcus epidermidis, and subsequent inflammation and subsequent infection now contributes and stimulates the acne phenomenon, creating discomfort, redness, pain, infection. As this develops, the movement and release of lipase enzymes then contributes to post-inflammatory hyperpigmented conditions, but also particularly to post-acne scars. The MG collection CLR not only features a base of 10 milligrams per milliliter of triple molecular weighted hyalofused hyaluronic acid, which promotes a smooth and effortless glide, but also contains an oligopeptide 10. The oligopeptide 10 is a laboratory synthesized peptide that is anti-Cutibacterium acnes. So the synergistic approach of 1,920 puncture channels per second plus an antibacterial and antimicrobial oligopeptide 10, the oxidation of your DP4 now kills Cutibacterium acnes and forces the reduction of associated Staphylococcus epidermidis. We need to reduce inflammation, and the role of niacinamide, but the role also of copper peptides and tranexamic acid reduce the redness and reduce the swelling. We understand particularly for patients who pick and squeeze their lesions that they will be affected by post-inflammatory hyperpigmented red macules or post-inflammatory hyperpigmented brown macules. So the combination of tranexamic acid and kojic acid dipalmitate serve as potent pigment inhibitors to rebalance the skin texture and tone. We use pyruvic acid at 2.5%, which now promotes a rekeratinization. So what this does is intervenes to now promote exfoliation and extrusion of actives out of the skin. The benefit of this, and the benefit also of the Hyla active, also activates lamellar granules. What creates exfoliation within the skin is a 3-point step. As such, this is my interpretation of a follicle. We have epidermis. We have our keratinocytes, which undergo the process of keratinization. The first intervention point that characterizes keratinization is the role of keratinocyte growth factor. This becomes stimulated as part of your DP4 procedure. Basal, spinosum, granulosum, lucidum, then corneum. In granulosum, we have what is contained lamellar granules. We spoke about these previously for their benefit and their role to release both ceramides and free fatty acids. But lamellar granules also are responsible for the release of enzymes, including proteinases, phosphatases, glucoside hydrolases, and also corneodesmosonin. These enzymes are activated through hydration. So you can hydrate an acneic skin. The hyalofused hyaluronic acid will reactivate these enzymes as part of intervention point number 2 to now further extrude and to promote regulated keratinization. The third intervention point occurs on stratum corneum, and it's called stratum corneum chymotryptic enzymes. You will never use these terms in your life, but they're called kallikrein-related dipeptidase 5, 7, and 14. To summarize, however, KLK, 5, 7, and 14. Again, this is a group of enzymes that become activated with hydration to facilitate regulated keratinization. So we understand when patients dry and strip their skin out, you dehydrate. When you dehydrate, you also deactivate the keratinizing effects of these enzymes and their role of keratinization. So the ingenuity of both DP4 and your MG collection CLR treats and targets the acne cycle at all levels, ensuring a safe, predictable, reliable outcome. Remember that Staphylococcus epidermidis will peak on about day 2 before its reduction, so do expect a phone call at this point. Otherwise, this will resolve completely by day 4. At no point do I recommend that you treat acne stage 4, acne fulminans, or acne conglobata, but a successful new approach as part of DP Dermaceuticals home care, as part of the MG collection, and combination therapy with your DP4. The MG collection RAS reverses aging and scars. And this is a sophisticated retinoid and pentapeptide 18 collagen modulating formula. Also with a base of 10 milligrams per milliliter of triple molecular weighted hyalofuse hyaluronic acid. This facilitates a smooth, easy glide that is comfortable even without use of a topical local anesthetic. As key collagen modulating agent, retinaldehyde is proven to be our most powerful non-prescription form of vitamin A, but is also shown to mimic the same effects of pure retinoic acid, however without photosensitivity, photodeactivity when exposed to light, or retinoid reaction of burning and irritation. The work of Crady and Vienne particularly acknowledges the retexturizing capability, but also the almost equal effects of retinaldehyde when compared to retinoic acid. We understand by comparison to aggressive retinol and also to prescription retinoic acid that retinaldehyde can redensify both the epidermis and also redensify the dermis itself without burning, without retinoid reaction. At a concentration of just 0.1%, it sounds very small. The abbreviation of retinaldehyde is called retinal. Retinal is not the same as retinol. So retinaldehyde is tested and is presented on the same scale as tretinoin or retinoic acid. And as such, 0.1 of retinaldehyde can equal the effects of 0.1% of retinoic acid. By comparison, this would equal 20% retinol, which is capped at 1% in the Canadian market. So we understand that there is potency, but we also understand that there is a reduction of retinoid reaction to now maximize collagen modulation, to reduce the effects of cicatricial healing, and as part of a DP4 procedure, the mechanical and chemical revision of scars. The combination of the retinaldehyde and a pentapeptide 18 blended in with jaturicide and Centella asiatica now assist with a faster reepithelialization and healing. The role of shiitake mushrooms manages imbalances of hyper and hypopigmentation, dyschromia, but also the role of copper peptides to facilitate the stimulation of superoxide dismutase. You will use your MG collection RAS for all scars, for all striae, and for all anti-aging skin regenerative righted reduction procedures. Your visual endpoint will be a minimum of pinpoint blood, and for scars, this will also be the case if they are red, blue, or purple in undertone. However, if your scars are older, if the fibrotic tissue is deeper within the skin, if the scar tissue is white, silver, dark purple, or dark brown, this is when you may need to target down into the hypodermis and you are looking for a moderate release of blood. The versatility of the MG Collection RAS delivers an active retinoid into the skin without the traditional complications. It is not recommended to proceed with this product on pregnant or lactating patients. The MG Collection HA35 is an unprecedented 35 milligrams per milliliter of triple molecular weighted hyalofused hyaluronic acid. 29 milligrams of the 35 are in fact the small molecular weight at just 10 kilodaltons. The MG Collection HA35 not only features an unparalleled concentration of hyaluronic acid, but also contains the hydroxyapatite or calfosome technology for further delivery of lipid-soluble ingredients in tandem with hyalofuse as an encapsulation system, but to promote a time-release delivery within the skin. Featuring both a vitamin C, zinc, and panthenol, this serves to facilitate effective wound healing and reepithelialization, but the versatility of the MG Collection HA35 allows for you to mix and blend it in with any of the other MG Collection products. So when you blend this in with MG Collection BL, you can target hydration, regeneration, and hyperpigment. When you blend this in with the MG Collection CLR, you target acne, comedones, and dehydration and volatility. When you combine it in with the MG Collection RAS, you target righted reduction, regeneration, increased hydration, rejuvenation, and glow. The MG Collection HA35 may also be used as a facilitator for the reconstitution of meso or microbotulinum toxin. It is recommended to reconstitute at the official on-label reconstituting rate. And through this, instead of using saline, you will use the MG Collection HA35 and then administer the meso or microbotulinum toxin via your DP4 device instead of traditional muscle relaxant injections. The MG Collection HA35 also contains an effective sticking and lubricating agent to activate your PRP and nano-fat procedures. We understand that PRP is going to create resistance and drag when topically squirted onto the skin. Likewise, once it's released from the syringe, it can begin to oxidize in as little as 90 seconds. So by drawing up your MG Collection HA35, preparing the skin and massaging it in topically, it now becomes a base or similarly a Velcro to hold your PRP. So on a prepared skin, using a closed syringe containing your PRP, if you then simply squirt topically, your MG Collection HA35 catches the PRP and then facilitates a smooth, easy glide and infusion with your DP4 device that is injection-free, that will not oxidize, and neither will dilute your PRP down. We understand the value of the MG Collection HA35 delivers intense hydration, the capability to mix, blend, and match with other MG Collection products, but to also deliver unique innovation for drug and also for PRP delivery into the skin. As arguably one of our more intensive, but as the most premium of the MG Collection range, the MG Collection HA35 Plus delivers superiority with an unprecedented 35 milligrams per milliliter of triple molecular weighted hyalofused hyaluronic acid. 29 milligrams of these 35 are the small molecular weight at just 10 kilodaltons. Also, as the only MG Collection product to feature the telomere technology known as geranyl lysopropanol, the MG Collection HA30 Plus features also the combination of retinaldehyde plus a combination of vitamin A, E, and C esters to now deliver a universal approach for rosacea, a universal approach for volatile complexions, for sensitivity, but also if you are not sure which MG Collection product to use, you have the MG Collection HA35 Plus. If you want versatility that treats and targets aging and pigmentation, that treats and targets acne and scars, that gives you a universal approach for multiple indications, this is the intensity and the concentration of the MG Collection HA35 Plus. As this product also contains retinaldehyde at 0.1%, it is not recommended for use on pregnant patients. However, otherwise, this delivers a universal approach for treatment on face, scalp, and anywhere on the body. Application of the MG Collection can be performed in many ways. However, I guarantee that we have changed your perception of microneedling. And as a superior method, you can either distribute it directly into a sterile kit for PRP preparation or for botulinum toxin, mesotox, directly onto the patient's skin. But otherwise, as the most sophisticated, but also theatrical administration, the use of a 5cc luer lock syringe now signals to your patient a serious procedure. Just as your concept, your thoughts on what skin needling was and could be have now been revolutionized since 9 o'clock this morning, your thoughts, your concept on what DP Dermaceuticals and the MG Collection can do and perform has also been completely changed. And so to promote this benefit, but to highlight to the patient the sophistication, the safety, the efficacy, but the ingenuity of chemical regenerative medicine, simply draw it up into a luer lock syringe. You can add a needle if you want, and then simply squirt onto the patient's skin topically, distribute and massage, and then use your DP4 to facilitate a smooth, easy movement, but to also infuse and maximize with an unprecedented 1,920 puncture channels per second into the skin. The MG Collection is the new non-negotiable. The MG Collection should never be substituted. The MG Collection now creates a predictable, a reliable, and a safe treatment outcome. You cannot make a mistake with the MG Collection. You cannot make a wrong choice. You can enhance by mixing, matching, and combining, But now this serves as your new negotiable. This now delivers the ultimate of strength, purity, and concentration, and to maximize potential for both mechanical regenerative medicine with DP4 and chemical regenerative medicine with your MG collection.